Hello guys, and welcome to Showtime TV and also to my YouTube channel. My name is Washe Ragekonyo and this is My Health is My Wealth. We were on a short break, but now we are back. We're back bigger and with more information. So stick around guys as we learn more and more about our health. Now, something that we need to know and something that everybody actually knows is that this is the peak season where our boys are undergoing the circumcision. Right, circumcision is transforming from a childhood to adulthood. But then we have many a times the times where we don't take precaution. What are we supposed to know as parents so that we prevent our boys from diseases, infection, external bleeding? Because we have had cases where young boys have bled to death or the wound has taken more time to heal. So I'm here to give you just the insights of maybe what you should do as a parent and of course what you should do as a patient. Okay, so another thing I wanted to educate you about today is about hemophilia, which is part of what parents should know about when it comes to boy circumcision and of course to other incidences such as when you cut yourself or maybe when you are going through maybe some sort of bleeding. Is good that you also learn about hemophilia. All right, so I'm going to start straight to what hemophilia is. Hemophilia is a condition which prevents blood clotting. Remember, the blood has four components. It has the plasma, it has the red blood cells, it has the white blood cells, and of course you have the platelets. The platelets are responsible for the clotting of blood. Hemophilia is when the clotting process is not taking place as it should, so the patient will end up bleeding to death. The reason why I've chosen this topic is because as I've given an example, some boys will undergo circumcision and then they will bleed and bleed and bleed, and sometimes it might cause damage of the organs and also sometimes death. So it's good that we understand what hemophilia is all about. Hemophilia is also genetically it's an inherited disease. Now let me help you understand what I mean when I say that's a genetic disease. We have other genetic diseases such as sickle cell anemia, and of course now we have hemophilia. So when the child is born, they inherit the X chromosome from the mother and the Y chromosome from the father. A boy will have the XY chromosome, but a girl will have the XX chromosome. Now, hemophilia comes in when there is an infection or the X chromosome is affected by factors that will prevent the blood clotting. So the hemophilia, what causes hemophilia affects the X chromosome. So the other thing you need to know is that hemophilia is more in boys. It actually affects the male. So because the X chromosome is the one that is affected. So if, for example, a boy is born, the XY chromosome, so the X chromosome is affected, the Y chromosome cannot act as a backup. So you find that this boy is going to get more infected. When a girl is maybe one X chromosome is infected, she has a backup for the other X chromosome. And in rare cases is when you have both X chromosomes infected. So that's why we say that hemophilia is more prevalent in the male, and that's why it is important for us to learn this, especially during this season of circumcision. Now, in some cases we have hemophilia infecting a patient, maybe not during, it might not be genetically acquired, but it might affect a child when they are born. Factors such as cancers and pregnancy can also lead to hemophilia. That one you're supposed to go and consult with your doctor. Maybe a child was born normal, but later on they are affected by hemophilia. Those are some of the factors that can lead to it. Cancers, pregnancy. Yes, so Now, because you know about hemophilia, let us learn about its symptoms. Now, you might have internal bleeding. Sometimes you find the patient might have a bleeding in their knees, in their elbows, and also in their ankles. So you find that that patient is experiencing maybe some swelling around the ankles or the elbows. So you find that they're also experiencing pain. Sometimes you may also have internal bleeding. That's a sign of internal bleeding. So when you have internal bleeding, when it comes to the brain, which might be caused by hemophilia, you find that the person might experience headaches. They might experience headaches. They might experience seizures and also dizziness. So when you find such symptoms in a person, it's good that you go get checked up for the in the hospital. All right, so we move on, and maybe say that there are two types of hemophilia. We say that hemophilia is normally caused by lack of protein, which helps in the clotting process. So there are two types of hemophilia. There's hemophilia A and there's hemophilia B, which you're going to do more research on that. Hemophilia A occurs as a result of deficiency of clotting factor 8. There are many clotting factors. So there are many clotting factors. Hemophilia A is caused by lack of clotting factor 8, and of course hemophilia B is caused by lack of clotting factor 9. Now, since we've learnt about hemophilia, let us before we wind up on hemophilia and now go into the basics of circumcision, let us know the symptoms maybe we are supposed to look out for when it comes to hemophilia. Number one, we have many large bruises. You find that a patient has large bruises and they have not been hit by anything, they have not been involved in an accident, so you find that this person has large bruises on their body. The second one, we have blood in the urine and also in the stool. It is good that also parents, when our children go to the washroom, we have to to actually check on the urine and also their stool to ensure that this child is safe. And also wewe mwenyewe, when you go to the washroom, always take time to look. I know, but sometimes it's good that you also check on that. Then you also have excessive bleeding when it comes to cuts. For example, you're just cutting your cabbage in the kitchen, or you're just, you get a cut and then you bleed and it's not stopping. You use precautions, but still it's bleeding. It means that you could be having a hemophilia, but not necessarily hemophilia. It doesn't mean that all these symptoms mean that you have hemophilia, but it's good that when you notice that you have excessive bleeding, you go see a doctor. And of course, excess bleeding during dental surgery, vaccinations. And of course, we also have another symptom of unusual bleeding, nose bleeding. So you find as a person keeps on nose bleeding each and every time, but there's no diagnosis, there's no particular reason. So if you notice that you have these nosebleeds, it's good that you go checked on it. And also we have a pain in the joints around the ankle, around the elbows and the knees. So it could mean that you are having hemophilia. Maybe you're having internal bleeding. And of course, you also look out for brain internal bleeding, symptoms such as paralysis, seizures, headaches, vomiting, double vision. All those are symptoms you should look out for, because it could possibly mean that this person probably acquired hemophilia and now it is presenting itself. But it doesn't necessarily mean that these symptoms that I'm talking about, you have hemophilia, but these are some of the symptoms. All right, so now look at diagnosis and treatment. It is always good to have your blood checked every now and then. It is good that, especially if you are expectant, please mothers, I always urge expectant mothers, go visit the clinic, because you're going to be tested for HIV, you're going to be vaccinated for tetanus, and of course such other diseases such as hemophilia, so that we make sure that we protect the future generation. It is good that you visit the clinic. Don't be too lazy. Enda kwa daktari, get tested for all this. Then of course the treatment involves placing of clotting factors. They could be gotten from a patient's blood, or they could be synthetically made in the lab. Now the synthetic clotting factors that are made in the lab are more recommended because they are not transmitted from one patient to another, so they are safer. So hemophilia is curable if you only take the precautions. Go get diagnosed, know the problem before the symptoms start kicking in. It is good that you go checked on that. Now that is about hemophilia. Now I'm going back to the initial main subject today is circumcision. As I mentioned earlier, this is the peak season where our boys are going to get circumcised. Now there are points to note. In Kenya, we have many cultures, many diverse cultures, and of course all over the world. Now, parents always make sure that when your boys undergo surgery, it is done under careful medical supervision. Ensure that wherever you go to take your boy to get circumcised. Now, I'm not against culture. I know there are those cultures that, you know, practice circumcision of boys along the rivers, in their houses because of their various beliefs. It is okay to honor your culture, but as much as that boy is being taken to the river for circumcision, are they safe? Are they taking the correct precautions? Is there a medic? The items that you're using for circumcision, the healing process, are they safe? So it is very important that wherever you decide your child to go for circumcision, ensure that they are under strict medical supervision. There should be a professional doctor stand by and always checking up on the boy. And of course, let us check the nutrition. Remember that you cannot just feed your child during that time, or your boy anything. Every time you're just feeding them with chips and indomie. It is good that we embrace nutrition. So even when you go to the hospital, it is good that you go consult a nutritionist and know what kind of food you're supposed to give them. You know that you're supposed to give them food rich in calcium, food rich in vitamin C, and of course food rich in iron. So it is good that you also do research on the nutrition that the boy is supposed to eat. And of course, one thing I need to insist is fluids. Let the boy stay hydrated. Remember that during circumcision, the wound is going to swell, and so the boy has to keep on going to the washroom. Ensure that the boy goes to the washroom, has fluid to go to the washroom to prevent the urethra from blocking. So every day, before they even eat something, before they start adopting to eat something that they are comfortable with, ensure that you cook them some good bone soup, ensure that you cook them porridge, ensure that you give them healthy, nutritious fluids to ensure that they are hydrated and that they keep on urinating. Then of course, another thing that we should look out for is there are those cultures where you have a boy has been locked in a room. They are supposed to be supervised by specific uncles. Oh, auntie so and so is not supposed to enter that room. Oh, your mother is not supposed to see you. But remember that this is your child. Now, I'm not saying that I'm against the culture, but even if you're not supposed to enter that room as a parent, how safe is your child? That uncle who is entering that room to supervise your child, how professional is he when he's going to change the bandage of your boy? Is he doing it the right way? Because you might find that this uncle will go and unbandage the child, treat them, and even make the matters worse. So always make sure that even if you're not supposed to enter that room according to their beliefs, just make sure that the uncle who is there is well equipped with knowledge and of course has a background information about taking care of a boy who has undergone that process. So again, let us know that times are changing. These beliefs of so and so cannot enter a room, I'm not saying they should be abolished, but people should also start having the knowledge. Another thing we need to do as parents is to avoid stressing the child child during this time of the healing process. Ensure that your boy has a good state of mind, because stress lowers the immunity. Ensure that this boy is, having fun during their healing process. They're having good vibes. Don't stress the child a lot. Ensure that even their clothing is good. Ensure that the bandage is changed after every 24 to 48 hours. Don't let this boy stay with the bandage for more than 48 hours and then you're thinking that the boy is going to heal. No, don't use clothes and all that to bandage, and make sure that the medication that you're given by the doctor is taken strictly. So another thing that we also need to watch is what is our child, the sexuality of the boy. Sometimes you might find that some boys might have already started engaging themselves in masturbation, and an erection during circumcision is very, very painful. According to research, when a boy has an erection during circumcision time, is very, very painful. So maybe you're having your boy, you've given him his phone, so he's there in his bedroom, and then maybe something just pops up and makes him have the erection. So I would tell the parents, please avoid even giving your children, the boy, the phones, because sometimes you might be like scrolling through, and then all of a sudden somebody just pops up and it might trigger the boy to have an erection, and then you're somewhere in the sitting room and then the boy is just screaming or just crying in the room, but you don't know the reason, but you gave them a leeway to look at such things that may trigger the erection. So make sure that even the music, everything that they are listening to is not going to trigger anything sexual. Then of course, let us embrace guidance and counseling, because sometimes you find that these boys, when they are joining high school, they have undergone the healing process. That boy is okay. That boy has healed well. They are no longer a boy, but now they're still having the behaviors for the boy, because they were not given good counseling. They're not given good counseling. So as the boy heals, make sure that men, people who are involved in teaching the boys how to become men, they give them good counseling, so that by the time they join secondary school, we also going to give our teachers an easy time. Let us avoid boys behaving like, young men behaving like boys because they were not trained. So make sure you take them, even if it's in a church, take them there, take them for that whole week, because you have professionals in these churches, and of course professionals in those churches, they're also supposed to embrace what I am saying. All right, so make sure that you check on that. Then of course we should know when to call a doctor. For example, if the boy has a high fever, if the boy starts shaking and has chills, if the boy has nausea and vomiting, and of course some rash that you don't know where it came from, it could be that it is telling you that it is time to call a doctor, because there could be a problem. So it is very, very important. Make sure that they are hydrated, and of course the best of it all is rest. Make sure that your boy gets enough rest. Ensure that they get enough rest, because this will avoid swelling. Wear loose clothes. Keep the the place that has been operated on very clean, very clean. The hands that are handling that wound should be very clean, and of course even the environment, and of course avoiding sexual activity such as masturbation. Yeah, so that is generally it. So as our good boys undergo this stage, congratulations to all the candidates who undergo in this process. We appreciate you. It's something that was God-given, and it is not only God-given, but it also helps in terms of health. It helps to prevent the acquiring of diseases easily. So it is a process that should be embraced, and it is okay. There should be no stigmatization on it, because it is a process that is supposed to be done, and it's a process that is acceptable. So let us take precautions during this time, and all the best as you heal. My name is Washirage Konyo. I have been your host. If you have any questions, please make sure you comment below so that I can look for the answers for you. I'm going to seek medical professionals to help with the topics that you might want me to discuss in this show. This has been My Health is My Wealth. It is good we embrace our health, because if we don't have health, even our wealth is useless. So let's stay safe there. I'll see you on the next episode. My name is Washerage Konyo. Bye guys.